Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. We have Dr. Williams here today, so I'll turn it over to him for some brief remarks.
Okay, good afternoon, and I hope everyone had a good weekend. For some, it was a snowy weekend, and so some bit of shoveling in that aspect, so safe driving. For today's update, I'll provide a brief overview and comments on the recent numbers, and then we'll go over to media for questions. Since last Thursday, we've reported in Ontario an additional 6,129 cases of COVID-19. Today, we are reporting a record high of 1,589. That's one more than we had on another Saturday. So staying around that upper 1,500, not quite cresting over 1,600, has been our trend for a little bit. The 7-day average rests at 1,429. So while we've had some dips, that number was down slightly from 1,443 1 week ago. So it's encouraging that we're not going up as rapidly as the modelers had said we might be, at around 2,000 cases a day by now. At the same time, we are still having high numbers. And what does that mean for us? We know that if you're looking at the data around the cases, 82% of all those cases are in the current red or lockdown areas. But of course, as you remember from what we announced last week, the number of ones going to red has increased. And of course, we didn't have any lockdown before, but we do have Peel and Toronto as of midnight early this morning. When we break that down further, the other interesting statistic is that Toronto and Peel make up about 59%. And that's actually down from what it used to be in the past, where if we took Toronto and Peel combined with York, we would be close to around maybe 75-80% of the cases. That's dropped down a bit, and while that's reassuring in one way, and we see Toronto seemingly holding the line at the moment and picking up on their case contact management and identifying a lot more outbreaks, it means we're having a lot more cases out in the other areas, in our reds, the new reds, in the oranges, and in some of the yellow areas out around the province. So that means everybody has to be stepping up and really doing a terrific job at preventing or keeping all the public health measures in place, doing that education, reminding people that even if you might have been in a green or you're in a yellow or an orange, you still have to be on your guard because it's just not the lockdown areas that have to be concerned. And in the testing ones, our 4-day average is 44,676 per day, which is quite high. And we continue to look at a positivity rate of just over 4%. Remember, a while back, we jumped up one day over 6%. We've had some drops down to 3.8%, but we seem to be hovering in that level there at the moment. Hospitalizations and deaths, we've seen 507 people in hospital with 156 patients in ICU. That's up from a week ago, 500 people in the hospital and 125 patients in ICU. So with those rising numbers, as we've already said, and as the modelers have said, that you will start to see this 3 to 4 weeks after we hit those big numbers, more hospitalizations and unfortunately more ICU cases. So we continue to watch and monitor that to see as we plateau on cases, will they plateau as well in the next number of days ahead. We still see people passing away. We had 62 people lose their lives of COVID-19 in this time period, and we want to offer sincere condolences to everyone who's been impacted. So, and it's not just those over 80. We have had some in the over 60 age group too. So it is concern across the board as we try to seek to keep that level of mortality down and morbidity with the hospitals both. But that's only as well as we're able to keep the case counts down, keep our community spread down, and keep from giving it to these vulnerable populations and groups, especially those in our long-term care facilities, but even those in the community with more comorbidity and other illnesses. They're there, and we have to protect them not only individually, but as family members, we want to make sure we do not bring it and give it to them. So this keeping on your guard with the public health measures is going to be very concerning. We're seeing that that in the modelers are looking at, we're getting an update later this week on the data of where are we doing, how are we cresting, are we able to say we're bending the curve on the rapidity of the rise of the cases. Having meetings just even yesterday with fellow CMOHs and with Dr. Tam across Canada, a lot of the issues are the same pressures in there. Mind you, the East Coast is a bit lighter, but the rest of the country unfortunately, including Nunavut, are having struggles and issues, case contact management overload. A lot of people having a lot of contacts, not following the basic public health measures of distancing, sticking to the households, staying at home, being, if you're ill, staying at home, and all those aspects we've emphasized from the beginning. They're having issues with that throughout the rest of the country. And so we're sharing on those common challenges that are before us. And also, we note on Friday that we brought into more stringent levels. As I said at the outset, we have now more places in red, more in orange, as well as the 2 in the lockdown. So we continue to enhance that. You're seeing some action with some of the local medical officers of health utilizing the role of the Section 22 orders to bring in further, I would say, targeted or tailored programs and restrictions that they see are causing increase and concern within their respective jurisdictions. So we want to see over the next while, now we have these in place, are we able to notice any downward trends? And I said already we see some places like Toronto, at least at the moment, holding the line on the cases. Will they be able to maintain that and actually drop it further? We're looking forward to seeing that, and of course it'd be encouraged if they were able to achieve that objective. So one of our main challenges again, and as we've gone through some of our festive seasons and more to come, is that to refocus back on doing those public health measures that we've said right from the get-go, that we know because of the evidence in science and droplet spread, that by distancing, by wearing a mask in public settings where you can't maintain that 6 foot or 2 meter distancing, staying home if you're ill, getting tested if you have any evidence of contact and or case or signs or symptoms of COVID, and as well limiting your activities, especially in some of the areas, just your household, and keeping that down, especially those that are attending the schools, to keep your child's cohort intact and not bring any contamination there, as we're seeing already in some areas, unfortunately, where people being less than stringent on their behavior have introduced it into the schools, and we're dealing with some outbreaks in schools to some levels that we hadn't seen before in 1 or 2 cases. And this is, I would say, concerning and disappointing to see this occurring, as we need to be diligent, we need to be persevering and consistent on this over the long run, especially if we're trying to make headway in this way. So we're urging everyone to do what you need to do to get this down. We've heard some more announcements today from the Premier on vaccine, and lots of activity happening, both at the federal level and as we're getting ready and planning here at our provincial level. So by staying the course and staying at it, it's not that there isn't any light at the end of the tunnel. We can bend the curve, but we can also wait and see what the impacts of having the vaccine and getting all that planning in place, as it looks like not only one, but a number of manufacturers seem to be coming out with I would say promising statistics on their effectiveness. So this is encouraging, I would think, for all of us as we look forward to that in the months ahead. So those are my comments at this time. And with that, I'm going to hand over to the media for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
From John McGrath at TVO. Please go ahead.
Good afternoon, Dr. Williams. The city of Ottawa has had, I think, the most optimistic case so far in the province. Its numbers are down substantially from the peak in October, but it took like 5 weeks for them to just get to half of the level they were at their peak, and they still have, as you know, substantial numbers of new cases. Given all that, is it realistic to tell people that this is a 4-week lockdown in Peel and Toronto? Should people be prepared that this could be 5, 6 weeks or longer?
Well, I think you raise a good question. Ottawa had been at its height and carried out a number of steps, both ones we had with the modified 2 level, and then they added local stipulations as well as some fines that the mayor had asked to be taken forward on. And they've seen the effect of those coming down. When we asked Ottawa the details of what single aspect was success, they didn't think there was a single one. So I think you've talked about the multitude of different ones that play in there, and therefore it takes a while to drive all those down. I think the question is that when we see these numbers, knowing that Toronto and Peel were already in the modified 2 with Ottawa, And before we put them in lockdown as of midnight or first thing this morning, and also there was extra stipulations added in by direction from Dr. Lowe and Dr. Davila a week ahead before that. So they've had some things in place already. So we're already seeing some plateauing and dipping a little bit. It's premature to make any conclusions. So I think where are we in the Toronto and Peel story of it? I don't know. Right now, especially the Peel ones are still going the wrong way. And we have to see how much further our actions with the lockdown and that of Dr. Lowe's can bring those numbers down further. But as I said, around the province too, we have some concerning increases in some of our new red and orange zones. So everybody's got to put their full energy into bringing this down. So will it be down in 4 weeks? Out of that, I would be surprised if we were down by that much to bring out into, remember, it wouldn't go from lockdown to anything. It would go down into red zone in that aspect there. So is it possible? It could be. Would we be pleased and surprised that? We would be. But that takes everybody's going to have to do a lot of really ramping up the personal behavior and the household contacts and that. And I know that for some it's challenging. But if we're not all pulling together, I think you're correct. We'd be surprised to see if we're out of this in 4 weeks. But it's a surprise I would like to be taken off guard by if we did. But let's see if we can do that. But I agree with you. It's seemingly unlikely at this time. We have to be logical about it.
I guess related to that, if the lockdown does end in 28 days and we then revert to the simply going back to the red zone, we'd still be talking about substantial new, things like indoor drinking and eating being possible again right at a week before, or I guess a bit less than a week before Christmas. And I'm wondering if there isn't some hesitation to reopen things almost regardless of where the numbers are right before the holidays, and would it perhaps be safer, as much as this is a hardship for everybody, would it not be safer to keep things closed until after New Year's, just so that we don't see people go a little nuts and blow off some steam?
I couldn't agree more. I think it's a very good point. Easing off just when everybody just wants to burst out and do some of the other activities. I think we're really encouraging people, and we hope to have some announcements later this week on what is our recommendations for the holiday seasons that are coming up. How should we ask ourselves to adapt to a COVID Hanukkah, COVID Christmas, COVID New Year, if you may. I think you raise a very good point, because if we go off the rails, as you're alluding to, and go into a lot of contacts, breaking down all the social distancing and that, we could see quite a big upswing of our numbers into the new year. And our major concern, of course, is that our school programs, for the most part, unlike what some are forecasting, have stayed open. And it looks like we're on track to stay open until the Christmas break. And everybody's done a lot of work to get that in place, both from the staff, the teaching staff, the administration, the cleaning staff, the bus drivers, the parents doing their part, and the students doing their part. Everybody's gone full out with the Ministry of Education, our committees. And you've put all this investment in. You'd hate to have that all of a sudden fall apart, because people totally went and disregarded all caution during the Christmas New Year's break. I still think you want to keep that investment in that cohort intact so you can continue in that valued investment. I've heard lots of emails about people very positive about how school has helped, but of course we're still dealing with all the dynamics of school and one's out of school at the same time in different modalities and hybrids, and working that. So it's an ongoing restructuring of how we handle it in that light with the Ministry of Education. So I think you're right. It would be risky to lift it at that time. So we're going to have to be very careful if we're going to consider anything in 3 or 4 weeks.
Next question.
Reminder to press star 1 if you have questions. Next is Charlotte Mondeau at Radio-Canada.
Hi, Dr. Williams. I know you touched on that a little bit before, but at this point, do you still think there's a chance to save the holidays in Toronto and in Peel?
I mean, you can have holidays, and we hope to talk about that on Wednesday. How do you do it in a COVID setting? And what can you do to make it that way by working with the various technologies, doing your visits at a distance, dropping off presents and gifts and sharing things, so you can still have a lot of things that are valuable at that time, whether it's Hanukkah or Christmas or New Year's, but you will have to do more of a virtual type context in there. So you want to look at what do you want to maintain those things that are valuable, much like we heard that a number of people during the recent ones in Diwali did a number of things in their own cultural context that were meant to be that balance between the cultural norms versus the safety issues. And that's what we're really asking people to start engaging on, even now with doing their shopping and purchasing in different zones, including lockdown, by thinking ahead and doing some things how and when do that, while still supporting the retailers, your own retailers in your area in there. So I think there's a way to do it. I think it will not be normal. It will be, especially in some areas, in a COVID context.
Mm-hmm. And do you know when we will hear more about the formal instructions for the holidays throughout the province? Do you have a date set in mind?
I think we're sometime around midweek this week to come back with it. We'll get a definite date to you on that one.
Last question, unless anyone else joins the line.
Next question is from Rob Ferguson at the Toronto Star.
Hi, Rob.
Hi, Doctor. In regards to your contract extension, I guarantee you've, I understand you've agreed to this. And I guess the reasons are pretty obvious. I'm just wondering if you're feeling a bit like a political football today.
I don't know about a political football. My task has always been, when I've been in various roles of coming down and dealing with outbreaks and I would say public health crises issues, whether in the past coming down as the first chair of the Provincial Infectious Disease Advisory Committee, coming down during SARS and being away from the family up in the north for periods of weeks in a hotel. I feel it's our task to come down and assist and help in these situations, not for what you get out of it, but more what you can contribute to it. And the same as even when I came down, I was asked to come in and cover for a bit in 2015 and asked to see if I would accept that role, because I had gone back up to my health unit to recruit and train up a medical officer of health to hand over. And that's what I like doing, looking at succession and building systems and preparing people for the future. So again, I was asked at this time by the minister and the premier if I would consider extending my appointment a bit longer and not leave in the midst of a crisis. And I think part of that is that, one, if you can make a contribution and continue to set up for building the system up, and as always when I started before the pandemic, looking at how we're going to build succession, knowing that, of course, the decision is not mine of who would be the next Chief Medical Officer of Health, that's the government's. But you prepare things for that to set up a good process and system, and that's what I try to do, is set up those system changes that make it more amenable and easy, but in the sense of a pandemic is not what we anticipated. And I'm working through that one right now, and to leave in the midst of it all, in one sense, while I could do so, it would be, in my mind, irresponsible, especially when you've asked and been asked by the confidence of the minister and the premier and others to stay and to stay the course, if you may, and to continue that while they continue their process to look for a successor in the position, I think is only but reasonable and responsible. So I have agreed to do that for a period of time as they put those things in place, and perhaps by the spring and into the summer, we may be out of the worst of it with vaccines. I would like to think so, and hand things over in a less tumultuous state to a successor.
Yes, thanks for that, Doctor. I'm wondering, in your career, if you've ever felt as much in the fishbowl as you do now. I don't know about all your career before this, but up in Thunder Bay, whatever. This is pretty high-profile stuff. You've been out doing newsers sometimes every day of the week. You get second-guessed a lot. How do you feel about all the second-guessing you get? You seem to bear it all with fairly broad shoulders.
Well, I was asked something like that similar before. I find that the focusing on solving the task at hand, collecting a lot of the task is listening. Someone used the phrase squinting their ears in the midst of all the noise to hear what the important messages are being said, even by the critics and those that are seen to be countermanding what you're seen to be doing, because sometimes behind frustration and perplexity by some experts and others, there is sometimes a good point to be made, and you don't want to miss that, and you want to make sure you incorporate that. So one of the challenges in Ontario is that being so big as it is, and being in it and having all the connections throughout with all my medical officers of health in the province of Ontario, and we make a team, and the associates, and including some of the managers and epidemiologists that I've come to know over the years, is that networking, contacting, listening, and hearing. It's very important to keep that in mind as you're trying to look at a concerted, I'll use that like a concert. That's one of the things that Ontario has. We have 34 entities out there. We have Ontario Health now. We have the different regional offices. We have all the complex structures that are coming together. And it's complicated, and it takes time to do that. So you can listen to some of the negative commentary, but I find I'm so focused on working at the task at hand and listening to all this advice and all the direction and giving advice as best I can to the deputy and to the Minister of Health and on to the Premier, that I think it's a matter of focusing and keeping my mind on those issues and making sure we're giving the best advice, and always concerned about the care of the Ontarians writ large. And that's just not getting COVID numbers down, but making sure some of the things we're doing are not having too much undue consequences on some of the more vulnerable populations. And there are other public health issues that are still occurring, and we can't disregard that. And I'm concerned about issues such as dental health of children in the schools. I'm concerned about nutrition status in the schools. I'm concerned about the opioid deaths that are occurring still in the province. So there's many things that still have to be there. And so in a way, I have some time to pay attention to the other ones. I want to make sure I'm listening enough to pick up the good points. But as I said, there's so many issues on the table. One has to keep their mind focused on the task at hand, or tasks at hand, and keep making sure you're bringing the best information, best advice forward to decision makers at the right time in the right way, while making sure your team stay intact and are not burning out and coming under the stress that this is going on a long period. We're over 300 days now. We're heading for a year, not far off. So this has been a long ultra marathon, and people have to really keep focused at the task at hand. So that's a long answer back again. To me, it's part of the job, because it's impacting everybody's life, and people are getting frustrated, people are getting perplexed and upset and would like it just over with. And we would all like that. But I ask people to stay a bit longer, stay at the focus a bit more. We can bring this down, we can bring these numbers down. I'm not sure I can make it the Christmas as you had in the past, but we have vaccines coming up the road, and so there's light at the end of the tunnel. So stay at it, don't give up, and keep at it again, and keep consistent, and keep caring for yourselves, your families, and your community, because we're all in this together.
Last question.
Melissa Candelaria at your TV, Halton.
Hi there, Dr. Williams. If you've answered this, I do apologize. I came in on the call a little bit after the 3 p.m. announcement, but I just wanted to get some sort of indication if it's when Halton may or if they will join the gray zone areas, a full lockdown, just with considering the fact that we've had our numbers go up slightly, and also the outbreak at Joe Brandt. I just wanted to get a sense of some of the indicators you're watching out for in our region that may decide or have you decide that we should follow suit with Toronto and Peel and joining them in the lockdown.
Okay, well, it was the same as we looked at the other ones. It's not a single metric. It's a combination of, as you said, your cases have risen a bit. You have some outbreaks that may be sequestered in a certain area, not community writ large. We look at the numbers per 100,000, how that's tracked over the last number of weeks. We look at the RE or RT, different terms for that, with the how that's trending. We look at the positivity rates of cases being reported in the area. Is that sweeping up? Is it moving slowly? We look at how then a key thing is to look at our hospital metrics, how the hospital's doing. Are they being overwhelmed? Are they getting close to being pressured to back off doing elective surgery? All these system issues that may be unique in that area. And of key importance is to talk to the medical officer of health and ask her in this case, how's it going? How are your staff doing? How goes the case contact management? Are you keeping on top of it? Are you able to keep it into outbreak clusters, or is it going community-wide? Are you finding more and more people coming when there were case contact positive saying, I didn't have 4 or 5, I don't know, maybe 30, 40, 50 different contacts. I can't keep track of them. And we're finding that happens when you get to these larger numbers. There seems to be a critical mass. And all of a sudden there's a group that sort of implodes and said, well, I ate out in groups and backyard parties, 5 or 6, and I just can't recall who everybody is. That kind of situation makes it really hard to control in there. So you can see it's a combination of a number of different metrics, and discussing it with the medical officer of health. And they've had discussions with their municipal, regional leadership on how they see it and what they need to bring the community back focused and when the right time might be. So I can't give you a simple trigger on that, and I don't think anyone would want that. I think we want to make sure we understand what is happening and the value or need of a lockdown, because not taken lightly. Lockdown is not an easy decision to make, and it's one we don't take lightly, but we do it carefully.
Follow-up, and this is the last question.
Yes, although us residents here in Halton are sort of sitting on the edge of our seats because in the old framework we did follow soon after Toronto and Peel. So I guess maybe my follow-up is, I understand that these are the metrics that you go by, what you had just explained, but are at this point, are you concerned about Halton at all, with what the data that you have in front of you as of right now? And could we see something in the next week or two moving into another framework?
Well, we are concerned about Halton. We have been concerned about Halton. That's why we moved them into the red zone a week ago. They just moved in on this midnight. So, yeah, we are concerned. And we are going to be working and discussing things again with their team again on Tuesday and Thursday. So this is an ongoing dynamic conversation. So that's the advantage of our framework, that we don't say there's 1 or 2 that are concerned, the rest are not important. I looked down at our list here, and then we moved into orange, the ones with yellow. We have 2 northern health units that are in yellow. We haven't had that in months. This is concerning, because sometimes in those northern areas, as they move up, even though it's not a red zone yet, we really want them to get a handle on that and bring it down, because they haven't got the same access to as many resources as we have some down of our centers here as alternatives to go to. So, yes, it does concern me they're in red. I want to see them bring those numbers down. We didn't move York up because York was in red, and because the medical officer of health said, we are containing it, we're on top of it, we think we can control it, and we can bring it down, and our hospitals are not stressed. So we took that, and so they have been much closer to the lockdown zone than you are in Halton, but it doesn't mean you can't go there. And that's the message for the people of Halton. By doing what you need to do it again, and do it consistently, you can not only avoid going into lockdown, you can get back down to orange and even further down if you keep pushing it down.
Thanks, everyone.
Thank you.